and welcome to the Borno Health Update. I'm your host, Ibrahim Amarawa. On our program, we track the advancements in the healthcare under Governor Zulum's administration. In this episode, we focus on the transformative efforts spearheaded by Professor Baba Malamgana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare systems. Governor Babagana Umar Zulum has stated that the massive investment in the recruitment and training of qualified health personnel, as well as improvements in remuneration, is a testament to how this administration is ensuring that physical infrastructure alone is not the only measure of improving healthcare system. The governor made this known through the Commissioner for Health and Human Services, Professor Baba Malamgana, who represented him at the 42nd Annual General Meeting of the Association of Public Health Physicians of Nigeria, HEALTH, in Maiduguri. Professor Gana began by commending the delegates for selecting this year's team, which aptly reflects the current situation in Borno State and also encourages those working in the health sector within the state.
I bring greetings to you from His Excellency Professor Engineer Babagana Umar Zulum, CON, MNI, Grand Commander of Niger Republic, who is unavoidably absent despite his wish to attend this meeting. He sends his warm regards. It's my singular honor and privilege to represent His Excellency on this very important occasion. This year's theme of healing in crossfire, delivering healthcare services in conflict and crisis, speaks directly to the reality of Borno State, and indeed many fragile settings around the world. It acknowledges the courage of health workers who continue to serve communities even in the most difficult conditions like we have witnessed in Borno State for the last 16 years. For over 16 years, conflicts severely damaged health infrastructure in Borno State. As a matter of fact, we lost 45% of our health facilities were destroyed. Health workers were displaced. Some were abducted, some were maimed, and some suffered from post-traumatic stress disorder. Supply chains were also disrupted, and communities were cut off from essential services. Yet, even in these darkest periods, health professionals continue to serve. I salute you all. Today, however, Borno is writing a new story. A story of recovery, a story of resilience, and a story of systemic rebuilding, bigger and better. Let me therefore commend Association of Public Health Physicians of Nigeria for consistently providing leadership in advancing population health and for choosing a theme that challenges us to innovate, to collaborate, and strengthen systems for the most vulnerable. I encourage all participants to use this conference as an opportunity to share evidence, strengthen partnerships, and develop solutions that will transform crisis-affected settings into models of resilience in health systems.
Professor Baba Malamgana briefed the association members on the step taken by Borno State government to strengthen its healthcare workforce through infrastructure development, such as establishment of new training institutions and specialized hospitals. He added that, apart from the state-of-the-art teaching hospital, which is set to be commissioned soon, there are also about 9 new general hospitals at various stages of completion.
Mainly in Gubbio, Magumeri, Dikwa, Mafa, Kadiri, which is really outskirts of Maiduguri, Shafa, Uba, Lassa, Kukawa, the list goes on, are nearing commissioning. Specialist facilities such as eye and dental hospitals have been established and are working well in Manguno and in Biu. An infectious disease hospital here in Maiduguri and our brand new orthopedic hospital in Maiduguri is about to be completed. These investments aim to ensure that quality healthcare is accessible closer to communities. Biu and Manguno General Hospitals are currently undergoing transformation with a view to making them specialist hospitals very soon. However, buildings alone do not make a system. Recognizing this, the administration of His Excellency Professor Babagana Omar Zulum has prioritized human resources for health. New colleges of nursing and midwifery have been established in Manguno and in Goza to decentralize training and correct long-standing geographical imbalances in workforce production. In the next 2 to 3 years, Maiduguri alone will be producing about 1,000 nurses and midwives annually. The government has also supported residency training for medical doctors, recruited and absorbed over 1,000 health personnel into the system in the last 18 months, and aligned doctors' renominations with federal standards, in fact, better than federal standards, to improve retention. The health workforce in rural areas in Borno State enjoy rural postings allowance, which is approximately 30% and above of their annual salary. At the primary health care level, revitalization efforts continue across numerous primary health care centers. In 2025 alone, 125 primary health care centers were revitalized, which included provisions of solar lights for the facility, solar boreholes, equipment, drugs, staff accommodation, all aimed at strengthening frontline services where most health needs are met. Financial protection is also central to the healthcare reform of His Excellency Professor Babagana Omar Zulum. The Borno State Contributory Healthcare Management Agency has been launched to protect civil servants from catastrophic health expenses, while plans continue to expand insurance coverage for vulnerable populations through the Basic Health Provision Fund. Emergency response has also gained the attention of His Excellency by the launching of the State Emergency Medical and Services and Ambulance System to improve particularly maternal and emergency newborn care or transportation. This ambulance system has got a toll-free number, which even if you don't have credit on your telephone, you can call the ambulance and the ambulance goes to the house where it was called, and we can track the ambulance until the patient is delivered to healthcare facilities. Indeed, we have received an award in Abuja in the last couple of months as being the most digital ambulance system in the country. Importantly, His Excellency Professor Babagana Umar Zulum commitment goes beyond infrastructure and workforce. It focuses on equity, prioritizing women, children, the elderly, internally displaced persons, and vulnerable communities through targeted programs and free specialized services. Partnership remains pivotal. Collaborations with federal agencies, development partners, and regional institutions continue to strengthen medical supply chains and system governance for a long-term sustainability. An example of such is the innovative Safer Birth Bundle of Care, which has reduced maternal mortality in Tanzania by 75% and newborn mortality by 40% in Tanzania, is now up and running in Borno State. Our data in the last 6 months of this Safer Birth Bundle is very impressive.
The special advisor to the President on Health, Dr. Salma Anas Kolo, while addressing the members of the Association of Public Health Physicians, praised Governor Babagana Umar Zulum for constructing and equipping a world-class Kashim Ibrahim University Teaching Hospital, describing it as one of the very best in the country.
It is particularly significant that this conference is happening in Borno for the first time in the Northeast, and also, as said earlier, I think the third time in the whole of northern Nigeria. The first happened in Plateau State, I'm not surprised, and then it also happened in Zaria, Kaduna State, and this is the first time it is happening in Borno State, in the 50 years of existence of the association. So I want to thank His Excellency and the Honorable Commissioner of Health for accepting to host this conference at this very important, critical time of our development. With so much to see, because Borno has a lot of experiences in terms of the resiliency they have demonstrated in addressing the insurgencies, which is one of the largest that has ever happened in the continent of Nigeria. And a lot of lessons to learn from it. And then under the leadership also of His Excellency Governor Zulum, we also went to see and learn about efforts towards reconstruction and revitalization of health facilities. And then the new one, I think you should also take your time to visit, I hope it's on the agenda, to visit the state-of-the-art teaching hospital, the state government teaching hospital here in Maiduguri. I saw it, and for me, I couldn't believe that we can have a leader that can put this investment in Maiduguri Township. You know, I used to say, sorry for teaching hospital, you're doing very well, you know, one of the best. But when I went to Newi, I said, Newi is the best that we have so far, and I called Ahijo, and he said, yes, I mentored him. But today we have seen, he said I mentored the guy there, so he had to do better than me. So, but today I have seen what we have that state governors can do. This is not a federal government project. This is a state government project done by a governor being confronted with disasters, conflict, and limited resources. Yes, he's able to put a state of the art. Honestly, you won't believe you are in Nigeria. And I said, this is the best that we have, in the continent of Africa. And the others should come and study and do the same or better. We've seen remarkable efforts in the human resources and several other things which I will not preempt the speech of the governor. This narrows the national direction, moving from emergency to sustainable system building. The Borno's journey teaches us that even in the context of fragility, it is possible to rebuild stronger, smarter, and provide more equitable health systems that can stand the test of time. And other countries have done it. Rwanda has done it. They've come out of war. We've also seen in Zimbabwe, with all the crisis that has happened, they still have a vibrant and resilient primary healthcare systems empowered by communities. So we are beginning to see that in Nigeria and in the city of Borno.
That was the Iron Lady of Nigerian health sector, Dr. Salma Anas Ibrahim Kolo. At the end of the conference, the Association of Public Health Physicians of Nigeria honored His Excellency Professor Babagana Umar Zulum, the Executive Governor of Borno State, and the Commissioner for Health with the Awards of Excellence. The recognition was in acknowledgement of their outstanding leadership and transformative efforts in advancing the state's healthcare system.
All right, distinguished participants. The Association of Public Health Physicians of Nigeria Annual Meeting Scientific Conference Maiduguri Borno State. In this very important gathering, the Conference Recognition Award presented to His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, FNSE, MNI, in recognition of your outstanding contribution to excellence in public health governance and leadership, and your unwavering commitment to advancing health quality in conflict-affected and fragile settings. Healing in crossfire, delivering healthcare services in conflict and crisis. The association presents you this award on this very important, memorable day, 11 February 2026.
Indeed, Governor Babagana Umar Zulum and the Commissioner for Health, Professor Papa Malam Gara, continue to receive increasing recognition both within and outside the state for their remarkable contribution to healthcare transformation of Borno State. The event was further enriched by vibrant traditional performances from the Borno Cultural Troupe and the Margi Dance Group. Congratulations to the Association of Public Health Physicians of Nigeria on the successful conclusion of your annual general meeting in Maiduguri, the home of peace. Meanwhile, the proliferation of illegal private health establishments remain a matter of serious concern to many. It is against this backdrop that the Honorable Commissioner for Health, in a decisive move to sensitize the private health sector, constituted a high-powered committee under the leadership of Director of Public Health in the ministry. Upon assuming its mandate, this committee swung into action and uncovered 2 illegal medical facilities operating in Maiduguri, which have been since shut down. The enforcement teams tasked by the Honorable Commissioner for Health, Professor Baba Malamgana, with the regulating private health providers, alongside the committee chairman, provided a further insight into their operations.
As you all are aware, the committee now is very active, as directed by the Honorable Commissioner of Health and Human Services, Professor Baba Malangana. Now we are regular with our inspection, monitoring, and supervision. So yesterday, I was directed by the Permanent Secretary of the Ministry of Health, Dr. Shekima Maina Mohammed. She had a report of these illegal and harmful public health practices in the communities. So the place was located along Madaganari bypass near Isan filling stations. We went there, we identified the premises registered or known as Pace Global, Peak Pace Global. So what we observed there, they are functioning as conventional facilities with their equipment, drugs, and their personnel. They have outpatient departments seeing more than 30 patients in their premises. They are rendering all services like malaria treatment, management of kidney diseases, hypertension, and everything. So based on observations, that premises was not registered and they don't have qualified skilled personnel. So, and is not accordance with the medical practice, all what they have been doing. So they lack the knowledge or basic skill. Even the head of that hospital, the MD, I think his field is computer engineering. The director, she read English. And unfortunately, that person or the operator will seal his facility last year opposite State Specialist Hospital. So we advise him appropriately and still went there to open another facility and operating the same things or even more than that of before. So the magnitude of the offense and what we have seen on ground is not tolerable. It will risk the life of the public. So as directed, we have taken all the necessary measures. We went with security personnel. I can tell you now, the case is with the security they're handling, and we seal that premises. So my advice remains the same to the public and to the people engaged in such harmful practice. Please, if they have not registered, they should facilitate closure of these premises. Even those that have registered, they should comply with the standard. And for the public, if they are seeing something like that, they should report it to appropriate authorities.
Thank you for joining us. Stay tuned for next week's update, where we will explore more innovations in the healthcare sector. This is Ibrahim Amarawa reminding you health is wealth and Borno is on the rise.